4.7. We're also hanging out on the City of Slidell's Facebook page. I got two gentlemen with me that we're looking forward to talking to for a little while this afternoon. Mayor Greg Cromer is to my right in front of us, and Dr. Charles Preston to my left. So whether you're joining us by way of Facebook or joining us by way of the radio, we're glad that you're hanging out with us for a few minutes. We want to thank both these gentlemen for letting us be a part of this. And Mayor, I'll throw it straight to you to start. A little quick welcome, if you don't mind, and then we'll get to some questions.
Thank you, Charles. Thank you for being with us today. Hello, Slidell. It's Wednesday, August the 19th, and we are still in the COVID situation that we've been in for the past 6 months. Dr. Preston is gracious enough to come back and have another COVID conversation with us today to talk about statistics and what's going on in the community and how we're trying to keep slowing the pace of the spread of COVID. But before we get into that, and I give it to Dr. Preston to give us some statistics and take some questions, we'll just talk a little bit about what's going on in the community. You know, we are still not hosting any major events in the community. No, we didn't have the linen night, the white linen night. We've not had any plans for future events this fall that we would do in the park. We're trying to do what we call pop-up concerts, where we may have a roving flatbed trailer that would go around the community and just pull up at an intersection and have a 30-minute live concert, you know, to kind of get folks involved in the community, but not get them in too big of a group setting. Maybe they could do it from their door stoop or from the front of a restaurant. So those are the kind of things we're thinking about doing. All of our public meetings right now, our city council meetings, things of that nature, are open to the public, but they are restricted by the capacity requirements of the City Hall chamber and the number of people that can get in to participate in those events. We're also streaming them live on Facebook and on the city website so that people that want to participate and maybe can't get into the room or can't make it to City Hall, they would be able to participate via Facebook or the phone. So please engage in local government. Let us know what's on your mind. Let us know what you're thinking. We're here to serve you. We're happy to serve you, and we need the input. You might have seen lately in the newspaper, the city economy has been doing fairly well. We're fortunate. We were down in the month of March about 6.5% in our sales tax revenues. We're down in the month of April about 3.1% in our sales tax revenues. Then we popped back up in May with 6.1, 6.3 in revenues. But in June, the June numbers came out and they just blew us away. We were up 21%. Now, part of that was a little bit of an anomaly in that about 10% of that increase was due to some late sales taxes being received after an audit occurred and realized that some of the tax payments have been calculated incorrectly, and the businesses corrected that. So that about 10% of that was an anomaly, but still we'd have been up 11%, and that's due primarily to you, the citizens of our community, supporting our local businesses, going and shopping in the local grocery stores, shopping in the local hardware stores, the pharmacies. All of those sectors of our economy have been up, and grocery in particular has been up significantly. Restaurants seem to be holding their own more or less, but they're doing some creative things to be able to do that with some outdoor dining and curbside delivery and things of that nature. So I'll finish this part by saying, please continue to support our local businesses. They drive our local economy. We're doing one thing with Charles on his radio station here, 94.7, the Lake 94.7, promoting local businesses. You might hear my voice on the radio inviting you to Slidell to come shop in our stores and our businesses, that we're open for business, and then maybe a couple of spots about local businesses and what they're doing. So please take advantage of what our community has to offer, even in these trying times, and support our local stores and businesses as much as possible. And lastly, I'll just throw out there before we go to Dr. Preston is that we are still doing testing. The state is still hosting testing in the parish. This week, the testing was occurring yesterday and today in Mandeville. Tomorrow and Friday, they will be in Pearl River at the Jubilee grocery store. I think they run from 8 till noon on Thursday and Friday, but you'll be able to do your drive-up testing there. If you think you've been exposed, you have concerns, you can go by and get tested for COVID there. That testing, I'm told, is going to be expanding in the next couple of weeks, and we'll have possibly testing on both sides of the parish again for a period of time as the funding comes through from the state. So, speaking of testing and COVID, Dr. Preston, thank you so much for being gracious enough to come over and join us again today to discuss COVID-19 and our trends in the parish and what it looks like and where we're going, and if you think we're on a good track or not. And I know that the masking seems to be increasing. People seem to be more prevalently covering themselves and slow the pace, cover your face. That seems to have kicked in quite a bit, and people are paying attention. So do you think it's having any impact, and are we doing the right things?
Absolutely. I'm really proud of the people of this parish for embracing the measures that are simple and necessary. Simply washing your hands, social distancing, covering your cough, and, of course, masking. I was very happy that as of 8 o'clock this morning, we had no COVID-associated deaths in St. Tammany Parish for the last 5 days. We haven't seen the big numbers that we had seen early on. We are averaging 0 to 2 deaths a day, and like I say, they seem to be on the decline. And I really do attribute that to the public's participation in the masking measures, which are so important. Looking at general trends for St. Tammany as a standalone parish, we are on a decline in terms of new cases per day over the last 21 days and the last 14 days. And of course, that's very important because those are gating measures both from the president's plan and the governor's plan. Unfortunately, of course, we're not judged on St. Tammany alone. We're judged on the entire state. And so while I think that we're doing very well in St. Tammany Parish, this is a bigger issue, of course, and people cross parish lines, and so the data can't be interpreted just in the face of what's happening in St. Tammany. I was a bit concerned, and I'm still a little concerned that the percent positive tests have been creeping up over the last several weeks, but even that seems to be stabilizing out at right around 7%. We'd like to get under 5%, and we still have some work to do, but they were really climbing, and on the 9th of August, we had peaked out the 10th at 7.12, and then it's been coming down and hovering right around 6.9, 7.01. So I think that the efforts of every citizen in the parish are really paying off, and this is going to have huge public health impacts, and of course the public health impact is going to translate to economic impacts. So we're certainly on the right track. We're doing the right things, and we just have to remain vigilant as we begin to open schools and children begin to return, to be very careful about when we leave our pods and go into public to do the important things, particularly hand washing and wearing a mask.
We are, go ahead, Mayor, I'm sorry.
You've said from the get-go, Dr. Preston, Chuck, that government was not going to slow this pace. Our citizens were going to slow this pace. And based on what you're telling us, our citizens have responded. We've done frequent videos and tried to present information to people. We've mandated or proclaimed that we're not the mask police. We're not going to walk around and tell people to wear a mask. But we're putting information out there and recommending that people wear masks. And obviously, by the trends and by the numbers, just as you said from the get-go, government's not the solution. It's our general public and their concern for each other. That's what's going to slow this pace. And it seems to be on track.
And I think that's absolutely right, and that's why I say, I'm so proud of the people of St. Tammany Parish, because they've really embraced these measures. And I try and stay out of big box stores, but even I have to eat once in a while, and I think now that people in stores without a mask are the exception, not the rule. And I mean, there may be one person out of 200 that are not wearing a mask.
A couple questions I want to. We're broadcasting live. We're at the city of Slidell, their city hall. We're, for sake of those joining us on radio, we're with Mayor Greg Cromer and Dr. Charles Preston. Of course, we're kind of jumping in on their Facebook event that they've been doing quite regularly. And so I've enjoyed getting feedback from Dr. Preston, because I think you're a real straight shooter. Even early on, when maybe some of the opinions you were sharing weren't as understood or in terms of the general public or as popular, you didn't mince any words. You really did kind of let people hear what you thought in a very plain way. So I want to start with hand washing, because obviously that was one of the very first things we heard. I'm not going to throw the mayor under the bus. I was not a big hand washer prior to this. I think I've washed my hands more since this started than I did for the rest of my life. So let's talk about the importance of hand washing. Is it still as important as we think? And kind of the myths and not so much the myths as far as what's the right way to do it and what's not.
Well, certainly I think it is a key measure in stopping the spread. And of course, one of the issues is if you cough or sneeze or get respiratory droplets on your hand, and then you touch something else, you can transfer those droplets. Far and away, the biggest vector of transmission is through expired respiratory droplets, either in speaking, yelling, coughing, or sneezing, and those droplets being inhaled by another person. But even though it's a small contribution, the direct contact through shaking hands or touching a doorknob or some other inanimate object has some contribution to it. The key really is to properly hand wash. Soap and water is certainly the best vector. You should lather your hands and try and make sure that you cover all of the surfaces, that you cover the palms and the inside of the fingers, then cover the palms and the outside of the fingers, wash the back of your hands, and do it for at least a minute, and then rinse the soap off, and preferably, if possible, use a paper towel to dry your hands. In the absence of soap and water, then disinfecting gels that have at least 65% ethyl alcohol will help to kill the respiratory droplets that may be on your hands.
All right, can we take it then to the masks? I've heard I'm wearing a disposable mask. You've got a pretty serious mask on. The mayor's got his LSU mask over there. Let's talk about, because I've heard talk about when to touch the mask, how often to wash the masks that are not disposable. Can we touch on that real quick?
Absolutely. I think the mask is critical. I want to say the study was out of Duke that was getting a lot of play recently. It was actually released a couple of months ago that looked at the different kinds of masks and how they filter droplets. We traditionally think of N95 masks that medical personnel or first responders use really protect both the public and the person who are wearing the mask. And then cloth masks like the mayor is using is very good at filtering some of those respiratory droplets, but those are more designed to protect the people who are around you. And so, of course, that means that everybody around you needs to be wearing a mask so that that person can be protected. And then this very high-tech study where they literally looked at the droplets of respiratory droplets with a laser beam, and they found that a respiratory droplet would come out and it would start to fall very fast because it was large, and then it would start to dehydrate. And as it dehydrated, it got smaller and smaller, and so it would suspend in the air more. And that was where they discovered that bandanas tended to filter out the large droplets but let the small droplets come out. And so a bandana is actually kind of counterproductive because it allows small droplets to come out, and they're going to hover in the air a little bit longer. So we kind of recommend against bandanas or neck gaiters.
That's what I was going to ask. So, and it sounds like you're saying tall people are more dangerous.
If you're a short person, I guess they are.
Yeah, maybe so.
Watch it.
I didn't say that. Did I say any name in here?
Watch it. Come on.
All right, we're talking to Dr. Charles Preston. We've got Mayor Greg Cromer as well. We're at the city of Slidell, and we're spending a few minutes with them understanding what's happening, not only and I do want to ask this, Dr. Preston. You talked about the state as a whole. So where are kind of the hot spots in the state? You talked about how well we're doing here in St. Tammany. What are the areas that are not doing as well?
You know, I have to tell you, I can't answer that question because I don't have that data.
All right, fair enough. But you feel good about what's happening here?
I do feel good about what's happening here, and not just following the numbers, but in looking at the community. People are being careful. They're wearing masks. They're socially distancing. I have not heard of a lot of very large gatherings, such as we're seeing in particularly Chapel Hill in North Carolina. I mean, that was just so irresponsible for those young people to get together. And I hope that our young folks understand that gathering in big groups like that is very, very dangerous. And I hear this argument all the time, well, I'm young and healthy and I'll probably just get through it. But then they carry that virus home to somebody who's not as young and not as healthy, who may carry it to somebody who's really not young and really not healthy, and that translates to a fatality. And of course, every infection we can prevent is very important because we don't know all the long-term complications associated with COVID-19. It took a while to identify the multi-system inflammatory syndrome in children, and that is really a post-infection complication. And we really don't know what kind of kidney, heart, brain injury will occur in a relatively healthy host from a COVID infection.
The idea of herd immunity was something we heard a good bit about as we've gone through this process. So can you kind of explain what that, I guess, concept is, and is that reality? Is it possible for us to achieve that anytime soon?
Well, the notion of herd immunity is that if enough people in a population are vaccinated and the disease doesn't have a place to find a host, then it will just naturally go away because there's nowhere for the disease to harbor and be replicated and be transmitted. I think that certainly it is something that can be accomplished. It is probably most safely going to be accomplished through a vaccination program. There's been some recent talk that more people than we know have been infected and may have immunoglobulin or circulating antibody. Where the science hasn't been strong is, does that circulating antibody actually provide immunity to the disease? So in other words, can a person with antibody be reinfected and get sick again? And that, again, is one of these many, many aspects of COVID-19 that is just not known yet.
The mayor was talking earlier, and he was talking about some things that have been happening almost all outside, almost all with this idea that we're keeping our distance from everybody else. And again, I know this is inexact. I know we're still finding our way. But so outside versus inside, what are there some protocols or some ideas that you could give people in terms of distance from each other, in terms of what's safe and what isn't? You're going on a boat. You're going to be on the lake. Safe, not safe? I mean, what do you think?
Well, you know, from the very beginning, we've always talked about risk mitigation. And so some people are very high risk takers. Some people are not so high risk takers. Certainly, even outside, if you're within, we've traditionally said 6 feet, although this new Duke study says that the respiratory droplets may go much further than that. I think that you're in a better position if you're outside. Safest would be outside with masks. Next safest would be outside without masks, at least 6 to 8 feet apart. Least safe would be elbow to elbow, hugging and kissing with no masks on.
All right, I got it. Mayor, let's talk real quick if we can. There were a couple of things that have happened here locally that I know you want to brag about a little bit. We did a cleanup under the overpass that I think was brought about by some feedback from some of your citizens that you wanted to make sure y'all tended to.
Well, yeah, we've been cognizant of the growing population of transients and homeless folks in the community. But we've also been cognizant of the litter that's occurring within the community, but also stimulated by some of the activities under the overpasses and things of that nature. And somebody brought it to my attention that 4, 5, 6 years ago, they did a clean out under the overpasses where they literally went through and did a sweep and then hosed everything down, cleansed it down. And it harkened back to my days when I was working downtown. And on every Thursday morning when you'd get to downtown New Orleans, under the overpass down there along Canal Street, city crews were out with pressure hoses and had been out since 4 o'clock in the morning. They moved all the homeless off of the median under the overpass, and they went through and disinfected and cleaned everything off. So I said, let's see if we can give this a try in our community and do a big sweep with Keep Slidell Beautiful and pick up the trash, hose off everything up there, clean it down, sanitize it. But taking that forward, we're looking at some preventative measures to keep people from being able to get under those overpasses up on the flat areas where they tend to create homes or shelters. And we're also working with the state to partner with them to do more frequent cutting of the grass at those interchanges, to do more as far as pruning of trees and keeping things just trying to beautify the community overall in general. The state doesn't do it to any great expense or any great effort, and it's our community, so we're going to step out and we're going to force the hands of the state and work with them and try to make things cleaner. But we were very effective at cleaning up those areas. In fact, I can name you 4 different individuals right now that through our faith-based organizations around the community are headed for home. We've got a guy on a bus that left at 8 this morning, 8:25, headed to Muncie, Indiana. We have another gentleman that leaves this evening at 10 o'clock going to Tampa, Florida. We've got 2 guys that caught a truck this morning that have friends in it. They're going to Phoenix, Arizona, where they have family. The faith-based organizations have been generous with helping buy bus tickets for these folks. And it's not just a bus ticket. It's not just a buying something, giving it to somebody. They call the places that these folks are going and make sure that there's a place for them to go, that they've got family members to receive them or people that can help them and receive them and get them on their feet. So it not only beautifies our community, but it helps some of those folks that need help in a way that they're not able to find out on their own.
We're hanging out with the City of Slidell, Mayor Greg Cromer, Dr. Charles Preston. Obviously, Dr. Preston, and I'm asking you questions like you have all the answers, but I do want to talk about schools real quick. You do have kids going back to school. There are all kinds of questions I think people have about that. On a simple note, I would be curious what your thoughts are when the kid comes home from school. In other words, is there I don't want to say decontamination process, but is there a process whereby parents need to bring their children back into the home, or is that overkill, or what do you think?
No, I think that's very reasonable, and I will say that I know the school board and the interim superintendent, Mr. Jabbia, has been working closely with Auctioner, who is very sophisticated at rolling out business plans and plans for the school. Again, it depends on your level of comfort and what you're comfortable with. I know that when I worked in the emergency rooms, when I came home and had small children, my wife would have me undress in the garage and put on a robe and come in and shower because I was exposed to a lot of body fluids and things like that. Again, I think it's very important that parents begin to educate their children now about how to wear a mask, how important it is to wear a mask, to try and encourage social distancing as much as they can. And we have to be pragmatic about it as well. You know that it's going to be very, very hard to keep first graders 6 feet apart from each other. But I think that certainly if they're wearing their masks when they come home, take that mask off, and they can either rinse it out in the sink with soap and water, or for my children who are in graduate school now, we sent them with 6 masks so they'd be able to change a mask every day and wash them once a week. And most importantly is to stay in communication with the school systems. And I have every confidence that the school system is prepared to reopen, and that they will continue to monitor just like we are in the entire community, that if numbers begin to soar and we have to roll back, that people in charge are postured to do that. And again, I don't have any personal knowledge, but I just have such good faith in the school systems that I expect that they're going to be ready to pivot on a dime.
What about flu vaccines for this fall? I've heard some conversation about those are possibly even more important than before.
I would absolutely say they're even more important than before. Because again, if somebody comes down with the flu, then their immune system is going to be sort of in a weakened state fighting that flu. And so a super infection with coronavirus, or the other way, an infection with coronavirus and a super infection with flu can have potentially devastating effects. So I think it's always important to get the flu vaccine, to protect yourself as best as possible. It is not a perfect medicine, but it is the best medicine available. And I think this year more than ever, it's very critical that we get vaccinated. And again, that may be a happy unintended consequence, that if people follow the same guidelines of washing their hands, covering their cough, social distance, and wear the mask, that hopefully we'll have a light flu season.
And then the saliva test. Have you heard about this? This idea that what are your thoughts on that? And then in testing in general, I'd like to know, I'm curious, you hear a lot of conversation about results, right? In terms of, well, they said I didn't have any antibodies, or they said that it was a negative, and then 2 days later I went back and it was a positive. So where are we with testing? How confident are you that our testing is good and that we're making strides, doing a better job?
Well, I think like everything, the testing is evolving. And I think there's a lot of promise in the saliva test. The issue will be, like everything, is once that it's proven to be effective and safe, then it's going to be a matter of manufacturing and rolling it out and getting it into the hands of providers who can do it. Even with current antigen testing, there are only certain centers that can do it because it's a high complexity test. The concern is when you rely on antibody testing is how to interpret that and how to get that result in a timely manner. That turnaround time is critical because the idea is you want to identify the sentinel case of infection and then reach out to the contacts and identify the contacts so that they can take appropriate precautions, including quarantine if that's indicated.
All right. Any other questions I should have asked you that I didn't? Anything else that was on your mind today before we go back to the mayor?
No, sir.
And then, Mayor, real quick, because I thought this was neat, the murals that you're doing around town. Real quick, I'd love to hear about that.
Well, we had some budget in our public cultural affairs office, and a lot of that was due to not being able to hold the events we've normally had. So we tried to figure out a way that we could incorporate our local artists who are struggling a little bit and create scenes or opportunities around the community for people to still enjoy the arts and do it just on their daily life and their travels around the community. So Alex Carolla, our cultural arts director, reached out some of the artists and got some ideas for what they would like to portray and what they would like to put on these murals. And then we went around to some of the local businesses and to the fire department and asked them if they were interested in participating. And lo and behold, 6 weeks or so later, 2 months, we've got public art coming up in a number of different places on our fire district office over around the train depot over here. We've got some that's in place now and some more that's coming there. over near the hospital. There's a walking path trail over there with a fence along that's going to have some art there. PD's going to have something. That one of the churches on the south side of town, I think, was doing something. So we're going to have about 6 or 7 different pieces of art around the community. That will be 6 by 8 or more murals, and one of them is going to be right here in building number 2. It's going to be a beautiful bayou scene that Phil Gladys is doing for us.
Fantastic. All right. Same thing. Anything else I should have asked that you wanted to cover today that we haven't talked about?
No, I don't think so. We're open for business in Slidell, as whether it be in City Hall or in local shops, restaurants, anything retail. We're open and ready to serve. We are following the guidelines that are projected by the CDC and coming from the governor's office and the folks that are above us that are in charge. We just want people to know that we're happy to have the opportunity to serve, and we're doing the best that we can during these trying times, and to hang in there, Slidell. It's going to get better. There's obvious signs coming from the coroner's office, from the statistics, that it's going to get better. Our economy is still fairly strong in Slidell. It may not be around the areas around us, but we're pretty upbeat. I'm talking yesterday with an organization that's looking to purchase part of the North Shore Square Mall and bring some business in there. I've had some inquiries from another organization about the old outlet mall over on Caruso Boulevard. There's some possible activity there. So there is business going on. We've not let down throughout this COVID, even though we've not been able to do it face-to-face as much as we have in the past. We're still generating opportunities and trying to grow our economy and grow our city in the manner that our community would like to see.
All right. Well, gentlemen, thank you both for letting us crash your party here today for a few minutes.
Yeah, Dr. Preston, thank you so much for joining us again. As we continue to go through this, we will get back together again, I'm sure, because our citizens want the opportunity to hear the data, and you have the data. So thank you so much for bringing it today and joining me in this broadcast.
Thank you for the opportunity.
Thank you, Charles.
We're going to send it back to the station. Slidell Mayor Greg Cromer, Dr. Charles Preston, the coroner, hanging out with us in the city of Slidell, and we're glad we got to spend a few minutes with them. For the Lake 94.7, I'm Charles Dowdy.